I was misdiagnosed, and as a result, I became more and more ill, and it left me with some permanent damage. My name is Maureen. I live in Edmonton, Alberta. I work for a consulting firm in the employee benefits field. In May of 2007, I started having some leg swelling and some severe pain in my right leg. The pain was so severe that I couldn't walk. It was something that I had never felt before, and so I knew that it needed some medical attention right away. It was a very difficult period for my family, for my friends, my co-workers. Everyone was very worried because they could see that I was becoming more and more ill. I was very, very pale. My blood count had dropped to the transfusion level. So when you get to that point, you're very fatigued. You look sick. And it was very troublesome because we really couldn't get any answers. Everywhere we went was sort of, oh, you try this, oh, you have a contused ankle, oh, well, you must have broken something, so you'd go through the x-ray procedure, you'd go through this, and nothing would show up. I'm lucky that I had a lot of family and I had a lot of friends that were very supportive and there for me. Due to the fact that it went so long without a diagnosis, I now have permanent damage. I've got something called PTS, which is post-thrombotic syndrome. When you're that young and you don't know what's wrong with you, and you have something that could potentially be fatal at any moment, it's hard on your loved ones. Before I realized that I had access to a second medical opinion, I was researching doctors in the United States and in Canada to go to, at my own expense, and get second opinions from. I had actually been in contact with a doctor in San Diego that we were looking at sort of doing a vacation and going there and seeing this doctor as well. Once I realized that I had access to a medical second opinion, I was very excited. I went online right away and checked it out, and then I called to get my medical opinion rolling as quickly as possible. It's a product that's offered with various group insurance products, and it was part of my private health services plan that I was able to access. The process was pretty quick and easy. I liked that the doctors were able to contact you directly. The case manager was very friendly. They really made you feel that your particular situation was going to be addressed, and it was going to be done so in a professional and timely manner. They take your actual blood work or your bone marrow biopsy slides, and they retest everything. So it's not like they're just sort of going on based on your medical files. They're actually taking your DNA, they're actually taking your lab information and retesting it. I think that once I got the second opinion, everything changed, my outlook changed. I was more confident, and like I said, I started to focus on things that I could do rather than I couldn't. It reassured me that I didn't have some disease that went missed. To be able to have these second opinions done at no additional cost and no traveling involved, it was just so great for us to be able to do that. I used to run before, I can't run now. However, there's things you can replace that with, like swimming and cycling and so forth. All of those things help me to feel confident about being the active person that I used to be again, but obviously doing it around certain guidelines. To have your confidence back and to know that you're being cared for properly and that you're on the right track to recovery is something. It was also encouraging to hear what types of medications I can use in the future, the advancements in medicine that haven't occurred yet but might occur. So even rather than going and having a surgery that would actually make matters worse, they discouraged me from doing that and encouraged me to wait and see how things heal. They said that due to my age and just due to the fact that I was very physically active prior to being sick, that there was still room for improvement, and they were right. I have more range of motion, more flexibility, more stability, and it's getting better and better. They did not beat around the bush. They said, these are the facts. This is what you can and cannot do. I think I was looking for a miracle cure of some sort, and they said it doesn't exist. However, they gave me the knowledge to be able to cope and live a comfortable and better lifestyle with the condition that I have. To me, it doesn't matter where the doctor comes from. If they are a leader in their field and their expertise is recognized and they're licensed, that's really what matters to me. To have a top expert in North America look at your case is very reassuring. I think the biggest thing that I was impressed with was the fact that the doctors are actually acting physicians in their field. They're not retired doctors that haven't been in the industry for 10 years or 15 years. So that was really important to me, to know that they were well respected in their field by their colleagues and by their peers. The services that were offered by the doctors was excellent. I was able to go back as many times as I wanted to ask questions. The doctors were very courteous, very friendly. They never made you feel like you were wasting their time or annoying them. They were more than happy to help you out. They sort of treated it almost like a business, almost like a customer, and they really want this client to have an excellent experience and feel comfortable. I would recommend it to anybody. And so WorldCare was there to give me that second opinion, to give me that ease, to ease my mind that everything was handled properly, and so that I was able to sleep at night again.